Hello, welcome to Health Matters. My name is Larry Williams and I'm your host. Health Matters is a program that's devoted to looking at health initiatives, healthy lifestyles, as it relates to our minority population in the city of Lincoln. Today my guest is Dr. Bob Rauner, who is with the Partnership for a Healthy Lincoln. Welcome, Bob.
Thanks.
So glad to have you here.
Glad to be here.
Why don't you tell us a little bit about yourself and also what brought you to Lincoln and how did you get involved with the Partnership for a Healthy Lincoln?
Okay. Well, I started out my career as a family physician. I originally worked in my hometown in Sidney, Nebraska. I'm actually a farm kid by upbringing. My wife's from Lincoln, and so we moved back here to teach at the residency program clinic about 2003. One of the things we noticed when we came here, we actually did our training here, is we were surprised at how much more diabetes we had when we came back versus when we did our training. And started getting an interest in why was that happening. And one of the things, of course, if you look in the research, a lot of it has to do with the obesity epidemic. And we were seeing a lot of it in our clinic. And so I started trying to work with some things with the clinic. Well, we work with primarily low-income minority population, refugee community. So there's a lot more of it in that community, and tried to do some things in the clinic. Found that we weren't having a lot of success, and I think one of the stories I tell people that kind of crystallized it for me is I was talking to this little third grade boy from one of our schools, and he is obese, and I was trying to work on my motivational interviewing techniques with him, and I said, so what do you like to do during recess to be active? And he looked at me and he said, we don't have recess. And I thought he was just pulling my leg, and his older brother chimed in and said, well, no, they got rid of recess a couple years in the school. And I thought, well, that's crazy. We're not going to make a lot of headway in this if we don't even have recess in the schools. And so that kind of prompted my interest in getting involved with obesity on the community level, and especially in the school system, and then started doing that in about 2007, 2008.
Okay. When was the Partnership for Healthy Lincoln? When did it come into existence?
That came into existence in 2010. I had spent about a year or two working with Mary Bell Avery, who's the Health and P curriculum at Lincoln Public Schools, about some things we could do, worked with her on some grants. And through that we collected data on kids in kindergarten. It was primarily the grant started with Title I elementary schools, so low-income kids, how we can make them more fit. The grant was actually successful, but through that we collected data on the entire community essentially, and we got to see a snapshot of Lincoln's kids, how obese they were, how fit they were. And the biggest thing that surprised me through all that is how much of it was tied into income disparities. And that if you plotted every elementary school and how obese it was versus its income, it was almost a straight line and a very steep line. We had, when we first started out, we had schools where 30% of the kids in some of the elementary schools were obese. And so we used that to actually start doing some grant funding, and in 2010 was able to basically combine a couple grants and launch a nonprofit to specifically work on this and assist the public school system on working on the project.
Maybe you can tell us briefly what are the goals of the Partnership for a Healthy Lincoln and sort of how does it operate?
Okay. Well, part of it, I had gone back to graduate school to kind of study the issue and got my master's in public health, and they actually have a whole system of how to attack an effort like this. And the first thing you do is you have to measure how bad it is, where it is, to try and give you some sense of where things are the worst and where to start working. And the other thing is by having a measurement you can decide, is what we're doing, is it working or not? Because you don't want to keep doing it if it's not working, and if it is working, you want to do more of it. And so basically we put together the nonprofit, started working on measuring this, and then started launching an initiative kind of after initiative. We started mostly with elementary school kids. Lincoln Public Schools has been a great partner. We've had a lot of people within Lincoln Public Schools that are very passionate behind this. Like I said, Mary Bell Avery was one of the first people who started helping me out with this. The director of nursing at the time, Judy Zabel, from the nutrition services, Jesse Coffey. It's really started getting a lot of people starting to kind of coalesce around a group effort to try and work on this. So it started out as a school-based effort, and then as we got more involved, realized really need to start doing more work with the communities, and that's where we started working with other nonprofits and other community organizations such as the Malone Center and El Centro de las Americas. So.
Tell us a little bit about how it's organized, because I don't know if many people realize that there actually is a board of directors like there is without so many other nonprofit organizations, and when do they meet, and just typically what's an agenda like at a Partnership for a Healthy Lincoln board meeting? Yeah,
well, there's kind of two layers of it. The entity as a whole tries to serve as a backbone organization to work with other nonprofits, and because we're in that role, we actually don't market ourselves a lot. We try to market what everybody else is doing, and so a lot of people actually don't know who we are or what we do. I say it's kind of like, I think is it 3M, that we don't make a lot of products you buy, we make them better. So we try to work with all the other organizations so that they're on a common message, that they're doing some things that are effective, and then one of the other layers that we bring them together to meet on a pretty regular basis, and of course you've been at a lot of those meetings. So every month we bring in a whole snapshot of people everywhere from breastfeeding to the YMCA to school folks to neighborhood organizations to say, okay, what are the things we're doing as a community to work on obesity and fitness that could all go together? And during those meetings, we usually start with a round robin. We don't really direct a lot of the meeting. Everybody kind of says what they're doing, and then usually as people start talking, they'll come up with great ideas where, well, oh, really, you're doing this? Well, if you could do this, we could combine forces. Or if we're both working at this grant, why don't we just both work on it together? And I think it's a way to kind of pool resources and get more done with less money. So.
And again, having attended those meetings representing the Malone Community Center, there's at least 20 plus agencies, or maybe 15 to 20 plus agencies that are there discussing what are they doing in the field of healthy lifestyles, healthy living, and healthy eating.
Yeah.
Okay. Maybe you can tell us a little bit about what some of the things that you are finding out from the research that you have done. I know one thing that you just mentioned, and I think, I don't know if any in our audience recognize that, is that there is a direct relationship between income level and obesity level, and that's something that you have found out working with LPS. Maybe you can kind of discuss what other things that you have found out in that type of research.
Yeah, that was probably my initial biggest surprise. Like I say, 6 years ago when we first plotted that, I was floored by how direct a link it was. And then we started rolling other things interestingly. We started getting basically obesity and fitness by ethnicity, so we could see what was different amongst the African American community versus the Hispanic community versus the Asian community, and started seeing some interesting things there. We started rolling in income status to see how those interplayed with everything, and we even started pulling in our academic scores like math, reading, and science, and seeing how all those fit together. The interesting things we see is that most of the things, luckily on the ethnic community, are more driven by economics than anything else, and so people aren't obese and less fit because they're African American. They just happen to be poor, and if you could fix that and you correct for that, you actually don't see that much of a disparity. So that's, I think, actually a good thing. That a lot of this is more societal as opposed to any inherentness in any ethnic group, and so that tells you the things that are fixable. One of the best things we have recently, there was a new report put out by the American Academy of Pediatrics showing that people have heard some stories about, is the obesity epidemic leveling off, is it getting better? There's been mixed results coming out of this, and what they did is they actually looked at subgroups and found that on average it's kind of leveling it out, but areas where it's getting better is mostly among the wealthy. But it's actually, if anything, not getting better or even getting worse among the poor and minority communities. And so that's kind of concerning. One of the great things about Lincoln is that actually we're getting better across the board. We've been studying this for 5 years, and year after year we're seeing improvements across the community. But if you break it down in groups, that it's getting better across all ethnicities, all income groups. So Lincoln's very unique in the fact that we've got the numbers to back it up that what we're doing is working. The other unique thing is, like you say, that there's 20 plus groups around the table. I've been hearing other people in the community say that's very unusual. To have that many nonprofits working together is more challenging than I think some people realize, and I think that's one of the great things about Lincoln is that the nonprofits really work pretty well together. So,
what else are you finding out? I think, I do believe that too, that collaboration and the relationship between the nonprofit community and our other institutions, government, LPS, whatever, very strong. But one of the other things that you do, and you brought a copy of it, is you put this report out. So maybe we talk a little bit about, I think everybody in Lincoln received a copy of this fine, colorful report. Maybe we can talk a little bit about what was in here and what are some of the conclusions? Yeah.
Well, basically what we announced is that we met one of our big goals. We started in 2010 and we had a goal of 2015 where we wanted to just actually reverse the child obesity epidemic and social measurable progress. And we actually met the Healthy People 2020 goals ahead of schedule, which was great. And then we also have, my actually thinking of this has evolved over time. I was really focusing on obesity first, but as you get into the evidence, it's actually fitness is far more important. So the aerobic fitness, and Lincoln Public Schools happens to measure that as well. And those numbers are also getting better and had a big jump this last year. And so those are the big numbers we wanted to announce. And then through the guide, what we did is basically just put everything through, and we actually organized it from birth to age, where we start all the way from breastfeeding to early child care to schools to neighborhoods to work sites, all the way into aging partners, that we're really trying to broaden the effort, not just the schools. The schools is a great place to start, but we want to make the effort broader. And then there's cross-cutting areas like, for example, the Malone or El Centro, the Asian Center, where you happen to work with the schools. You also happen to have a neighborhood organization, but you also happen to work with an ethnic group. And so there's lots of different ways to try and push out information to the community. And so what we've done is try to figure out all these different ways to push out the message through everybody else, essentially. I sometimes jokingly tell, Roger, for example, at El Centro that, I can bring a lot of the message, but I'm not the right messenger. I'm a white farm kid from western Nebraska, where Roger Garcia, being of that population, is going to deliver it better, or him or Veronica. And so we try to work as much as possible through these other organizations. And partly also ways is just scale it up, that if we can push this out through so many different areas, you can actually touch a lot of members of the community.
And I think that's another part. The Asian Cultural Community Center is involved in it, along again with the Malone Center where I work at. We're involved in the Partnership for a Healthy Lincoln. What else have you found? I think it's what I think has been really unique and novel has been the role that LPS plays in this. And then we have a person who is there at every meeting to talk about some of the things that we're doing at LPS to make the changes in obesity and diabetes and fitness. And maybe you can talk a little bit specifically about what were some of the things that we employed or that that have been employed by this initiative to make us reach our goals so early.
Well, the great thing about a school system is it touches just about everybody in the community. It's so broad. In Lincoln, with one major school district, they reach 85% of the kids in Lincoln are there every single day. And so what a great way to reach so many people and across basically every strata, income, ethnicity, region, there, frankly, everywhere in the city. A lot of great neighborhoods, the school is the center of the neighborhood. And so the more you can get the neighborhood coming into the school, the better. But because it's such a broad group, if you make any changes in that big an entity, you can have a big impact on the community. And that's why most successful efforts start with the school system. And so a couple things we did. One is that we actually changed the lack of recess. Every school now does have recess and a physical activity break in elementary school.
When I was growing up, we always had recess. Always had recess. And I was just surprised. It really stopped.
And I still get that right now. One of my next big phase, or one of our next big things we want to try to do, is increase the PE time in elementary school. And because of pressures from No Child Left Behind, math and reading scores, we're down to once a day on average in elementary schools. And that usually shocks people, because most of us grew up and knew that recess was something we had very frequently, if not every day. And we also had we had PE, then we usually had a longer recess. Recess has gotten really short. We're making some progress there, though. We've got now recess and physical activity breaks in every elementary school. And then they're also doing a lot of things. And Michelle Welch, the wellness coordinator, was a big project. When I first started talking to Mary Bell Avery right at the start, she said one of the things we really need is a wellness coordinator. They had a great wellness policy, actually, but there was nobody really implement it and carry it out that had the time. And we needed somebody whose sole job was to carry that out and implement it. And we got really lucky. We pulled Michelle Welch. She had been working in corporate wellness, and so she had a very broad background, and then she also has a little bit of the cheerleader in her, which helps too. You have to make it fun and interesting. And she's been able to make a lot of feelers out, and she has kind of peeps at every school, essentially, to try and help her carry it out. She's gotten some funding from Ed Koppel, who actually provided some incentives and a wellness challenge. So if the schools that did the best got some money, which they could direct at something like their walking path, which kind of made a nice incentive. She's done a system of quarterly challenges, and she's really made them broad, which I really like. It isn't just about eating vegetables. It's about fun things. She actually even did a challenge about giving back, where people had to do something nice for somebody else. She's had sleep challenges. So really has made it a nice broad focus that I think a lot of people have been able to really get involved in. And she regularly gets attendance logs back where she'll have 5,000, 6,000, 7,000 kids that'll participate. And then she does another neat thing, and she tries to get them as much as possible to go home to the parents and make it become a family challenge. One of the most predictive things about a successful effort is if the whole family gets involved. It can't be just the kid or just the parents. And so she's been really good at getting that to work out. And so I think that's probably one of our unique things, that not a lot of schools have a wellness coordinator like that who really works. And she's got a great background as a dietitian and a real good background. So that's been a big deal.
Maybe just touch a little bit on this, and I think once again we've reached some of our goals, and it seems our kids of color are doing much better when it comes to the whole notion of healthy lifestyle, healthy eating, obesity, and fitness. And maybe you can talk just a little bit about that.
Well, the good news is because we collected on all kids, we actually have enough kids that we can actually tell by ethnicity how it's getting better. And almost every one, we've seen significant differences right now. Some it's just because the numbers are small, so it's hard to tell yet, but we're seeing it across the board, which is great. In Lincoln, people are surprised at the diversity within Lincoln, and sometimes I actually say the diversity within the diversity. So African American is not just traditional African American in Lincoln. As you know, you've got Sudanese and Ethiopian, and so there's a huge variety within our
immigrants and refugees, along with the traditional, quote, people of color.
The Asian community. You've got everything from Karen to Vietnamese to Chinese to Thai. I'm amazed sometimes even just the Iraqis, where you've got Sunni, Shia, Yazidi, Kurds. And so it's a really unique place. And I think I've actually learned a ton just by learning within those communities. And they do some really interesting things. The number of refugees has actually made a little bit twist into it, in that when you come from an area where there's really far more poverty than we're used to, where literally sometimes the skinny kid can be a dead kid. They have a different view of food than we do. And so it's trying to, how they adjust to American culture has been an interesting thing. The flip side, though, they actually in some ways, bring very healthy habits with them, meaning they're more inclined to breastfeed. They haven't lost that like we have. A lot of them are actually farmers from their area, and so one of the interesting things I think is the community crops, trying to get them back to farming actually, and so
Now,
trying
most
to
people
retain
wouldn't
some
even
of those
think of
things.
community crops and the importance of healthy living, because that's all interrelates. Go ahead. I'm sorry to interrupt, but
No, I mean, it's just interesting, the synergy of how things can involve everybody, everywhere from, it's not just you, for example. Sometimes it's you plus the school plus community crops plus the YMCA all working on a joint project. And that's been a really fascinating process for me. I've learned a lot from the whole process just by that. Another thing, I think we've gotten more traction in the Lincoln Public Schools the last couple of years, because we actually rolled in all our math, reading, and science scores, and so it made it kind of a win-win. It turns out that fitness is very tightly correlated with how well kids do academically, and so if you impact one, you might actually impact the other, and kind of kill two birds with one stone with that. If we get the kids more fit and active, they actually may return their lessons better, behave better, get less in trouble. That kind of thing.
And some of the research has indicated better fitness, better school, better school grades. Okay. What are the next steps for the Partnership for a Healthy Lincoln? Where do we go next?
Well, since we made 2015 targets, now we're talking about the 2020 targets. Where do we want to be? We kind of set, actually we had a peer to compete with. Kearney Public Schools, interestingly, has one of the best child obesity prevention programs going on in the country. We actually kind of said, if they can do it, we can do it. They've actually doubled the 12 and 2020 people goals already, so we actually are tentatively setting that we want to do that too. That the child obesity reduction goal for Healthy People 2020 was a 10% reduction. We may see if we can do a 20% reduction by 2020, so even do it one step further. One of the things we've learned, though, is where our progress is happening is mostly in school age. But we're not having our progress happen in the before school. The kids still show up to school the same obese as when they did 5-6 years ago. And so I think we need to broaden our effort back to as starting as early as with breastfeeding and healthy nutrition, even as toddlers. We're launching some efforts to try and get more involved in the daycare centers. Teach a Kid to Fish is doing some really interesting stuff. They have a curriculum called Go Knapsack that they work with the licensed child cares. And then Community Action Partnership of Lincoln is taking that same program and trying to work with the unlicensed daycares, the home daycares, Head Start, other ways. So we're trying to find different ways to try and get these things percolating up as young as possible. And then now we're going to setting fitness targets now too. So we've made a lot of progress in the kids passing that aerobic fitness test, where they actually have the kids, they run this test every year in 4th through 8th grade. We want to set targets to try and get 80% of the kids passing in all grade levels that they test on. And we've made, I think we can do it in a couple more years. The PE teachers, especially in the middle schools, have really been able to take this on because they have enough time. Elementary school, we just need to get more time of PE to make a difference, but I think we can do it. They're doing a lot more efforts with around school time. So for example, the community learning centers, where there's that undesignated time after school is out, but parents aren't home yet, so you've got about 2 to 3 hours after school. Is there some things we can do that? And so we're doing something with Leanne Johnson and Barb Frazier to see what they could do in all the community learning centers. There's 25 of those in Lincoln. You do a couple of them yourselves with the Malone Center. That's a huge kind of untapped time, because there's a lot of flexibility within that time. Within the school day, sometimes things are just so regimented because all these regulations, but you've got a couple hours where you've got kids where you could do a lot of things with them. And so we're working on doing some things similar with, like having Michelle Welch for a wellness coordinator for the district. We're going to have if we can have another one for all the community learning centers and getting them to do some joint projects.
Sure. Anything else that you would like to add about the Partnership for a Healthy Lincoln? We're about at the end of our time.
Yeah. I think basically the biggest thing is just trying to figure out ways you can plug in with this. Our next big frontier also is going to be working with employers in town. I think some of them, I think we're starting to make the economic case for this actually. The studies are out as far as what the economic cost of obesity and fitness, and that if we can make the case that doing all this stuff, it's great for the kids, they're healthier, they're going to live longer, they're going to do better academically, but also it's going to potentially save money for the employers, so maybe we can get the employers more involved. And we have employers in the community that are doing a really good job, like Lincoln Industries, Duncan Aviation, for example, with their own employees making a big difference. So,
Well, thank you, Dr. Bob. I greatly appreciate you being here. here and to talk about what we're doing with the Partnership for Healthy Lincoln and how it affects all of our kids, especially our kids of color.
Okay.
Thank you for taking time out of your busy day to be with us.
You're welcome.
This has been Health Matters with Larry Williams, and once again, we appreciate you taking time to look at our program. Our topic today was the Partnership for a Healthy Lincoln and how it affects all of our kids. Again, thank you for tuning in, and we will see you next time on Health Matters. Have a good day.